by drawing on a Nairobi-based intervention as a case. And for finer details about this study, I am going to leave behind a list of references because we really don't have a lot of time for me to delve into them today. So any questions you may have about methodology, sample sizes, so on and so forth, everything is freely available online. But for our purposes today, I'll just be touching on a few other things. Now, this intervention had several components, and it involved a number of moving pieces. But if I had to summarize what it was about, I would simply say that this VAC intervention, sorry, you're on the wrong slide, you can move back. I would simply say that this VAC intervention, it was all about multi-level dialogue. In a word, it was about communication. And it was about communication around violence against children at many different levels, all at the same time. And I'll continue in the spirit of boldness that I started out with by saying that in many ways, the violence against children problem that we are experiencing on this continent, or in Kenya specifically, is a communication problem. Whatever we can't talk about is a festering problem. It's a ticking time bomb. But I don't want you to take my word for it. Let me share some experiences that children in Nairobi have shared through this study or intervention that I'm about to delve into. These are children who experienced sexual assault. And they talked about not being able to talk to their mothers or their caregivers, particularly their female caregivers, about what they had experienced in the past or about what they were currently experiencing. In fact, only 4% of children, and I'm talking about a sample size of almost 500, only 4% of children who disclosed ever having experienced sexual violence were willing to discuss their experience with their mothers or their female caregivers. And among those who disclosed that they were experiencing it currently, so not just a lifetime experience, but I'm actually experiencing it right now, among those who said they were experiencing sexual violence currently, none of them wanted to or were willing to obtain care in the company of their mothers or their female caregivers. And that is where I think this slide comes into play. You can move to the next slide as well. Yeah, and you can stop there. No. Yeah, you can stop there. So if you saw the previous slide and this one, it tells you, it gives some instances of what we heard from children about not being able to talk to their mothers about this issue. We don't have the time for me to read them out. Hopefully, they're visible, they're legible for you. And the children often talked about how, these are not things that I can talk to my mother about because my mother is really tough, right? Remember, this is a Nairobi-based study, and tough often means, if you agree with me, for those of you who are based here, strict, right? A disciplinarian. I have a very tough mother. And you see in the last quote, there's a mother actually saying, yeah, I'm really tough. My daughter, there's no way she can talk to me about this, right? So this is what we kept hearing, that because of that need for a parent to be tough in order to be perceived as a good parent, children didn't want to talk to them, about these particular issues. And so this authoritarian parenting style, and I saw from the abstracts that there are some abstracts around, parenting styles and so on and so forth. But this particular authoritarian parenting style that most of the children in this study were exposed to, it might have had some protective benefits. So my intention is not to knock, particular styles, but I will say that what the evidence shows is that it really left no room for dialogue between children and parents. And what it did was it rendered these children, both boys and girls, very vulnerable at the end because there was nobody to talk to. So what did we do about this quote-unquote communication problem? We began to focus on stimulating conversations at different levels, and we used 2 primary schools as our intervention context. Next slide. This next slide sort of outlines what these interventions were about. When I talk about communication, conversations, we started with parent dialogues, which involved conversations with parents in these 2 primary schools. working with the schools to bring together parents of all children in particular grades. And we're looking at standard or what the primary 6 to 8. Just to talk about sexual violence, their concerns, what they were seeing in their community, what they felt could be done about it, what they were worried about, so on and so forth. And children were also integrated, into these dialogues. They did, plays and so on and so forth, showing how sexual violence manifests in their communities. And through this dialogue, which we can refer to as one large conversation, other conversations began happening. So right from the very first dialogue, parents began approaching the dialogue organizers, the schools, us, Kenyatta National Hospital in Kenya, which partnered with us, and saying, I need a one-to-one session with you. I know this is about our children, but I also need to speak to somebody. I suspect my child is experiencing some form of violence. I don't know what to do with it, and I don't know what to do, and that's why I've not talked about it. I don't know where to go. I'm not sure what will happen to me if I admit that this is actually happening. And so parents began receiving counseling as well, ever before the intervention really took off. Then after the parenting dialogues, or alongside, we introduced student sensitization sessions, which was during the normal school assemblies on a Monday. We would have trained professionals there and talking to the students for a few minutes about the fact that we're about to start an intervention in your school. We've been talking a bit about sexual violence. We're going to have a couple of people seated here in your school, and they are available for you to come and talk to about anything you want to talk to about. But they're also going to be asking from some very specific questions to you in private, to each of you in these particular classes. Next came the stationing of trained psychologists at the primary schools. There were 2 psychologists per school, and they were there for the whole school day. So they were available to talk with the children during break time, during free periods, after school, during after-school activities, about whatever was on the children's minds. But their main task was to screen children for sexual violence in particular. And I have to say that screening is yet another means of fostering communication. It entailed proactively asking each child in a private, confidential manner if they had ever experienced sexual violence, and those who had received immediate school-based counseling if they wanted to. Those who, and counseling is another form of communication if you think about it. And those who were categorized as acute cases, who experienced more severe forms of sexual violence, because as we know there are many forms, they were accompanied to the One-Stop Center for Comprehensive Care. Of course, we had obtained permission from parents in advance during the parenting dialogue, and the majority of parents opted in for this, and the majority of children also opted in. And so parents of children who are identified as being survivors through the screening exercise, they would come to school to seek counseling for themselves as well, and to obtain information about how to deal with the issue at home. So from the very first dialogue, parents who were not eligible to attend, so in other words, these dialogues were for students in primary 6 to 8 in these particular schools. But what we found from the very first dialogue was that parents whose children were not even in the school and therefore were not eligible also came to attend because they wanted to hear more about, how you start this kind of conversation, and they wanted to hear, what was going to happen as a result. They wanted to talk about these issues but didn't quite know how. We also invited chiefs and community leaders to attend these dialogues and to be part of the conversation. And as the results from the screening exercise came in, we would communicate them to the parents and to the schools, and to point out what needed to be done to strengthen the intervention. For instance, the first dialogue in both of the schools, who turned up? I should have put pictures here. You would have seen huge halls full of women. It was the mothers who came. So it was a parent dialogue, but it was the mothers who attended. And so the question was, how do we get fathers to participate in this conversation and to play a role? And so what we did was, they said, if you want men to come together, you need to do a goat eating. If it's a goat eating, men will come, for men only. And so we had Father's Day. It was a goat eating in each school, only men, and the halls were full of men, and the conversations were on fire. And men communicated about their concerns. And men realized that they had to be champions for their children, and so on and so forth. We found that an intervention that was designed for school settings began to have a ripple effect in the wider communities around the schools. So parents began to reassure their children that they could talk to them about violence. Children began to talk. And parents began to proactively mobilize themselves to track down perpetrators and to take them to the chiefs for action. This had nothing to do with the study or intervention, but just because we were sort of following up to find out what else is going on, we realized that what we had intended for schools only began to take on a life of its own, and perpetrators began moving out of the communities. Importantly, about half of the children who were screened in the schools turned out to have experienced some form of sexual violence. So it was 49% for girls and boys combined, about 60% girls, 40% boys. And out of these, 75% received care. And here is some of what we heard from child survivors toward the end of the intervention. Next slide. We kept hearing the words, thank you. And you can see, well, maybe you can't see so well, what the children had to say, right? From 13-year-old boys to 13-year-old girls, and those that were even younger than that, just saying, thank you. Thank you for teaching us to tell someone. Thank you for telling me that, next time this happens, make sure you do X, Y, Z, right? Thank you for telling me not to keep it to myself, because I told my parents and I found that I was surprised that my parents ended up supporting me. I thought I would get in trouble. I thought I would get beaten. So we continually heard, thank you. I thank God you people talked to us, because before I wouldn't have known what to do. I'm so grateful. So I see I have 5 minutes left, but I am done now. So after sharing all of this, what is my point? My point is that the solutions that we need may not be so far outside of our reach. I know we have been and will continue to talk about a range of possible solutions throughout this conference, solutions to violence against children. The communication element within all of these solutions should not be taken for granted, but should rather be teased out, examined, analyzed, and elevated to ensure that we win this war. Let's work together to effectively communicate our way out of this epidemic. Thank you. Next slide, next slide. Next slide has the references for anybody who might be interested in the end. Thank you.
I don't think you need to go and sit, but you can just be seated here in the front. Thank you very much, Dr. Chichi. I don't know whether I'm pronouncing it very well. Chichi Undie, Iranian as well. Thank you for your good presentation and the insights you have given us. And I know from the VAC survey 2019, we found that most of the cases of sexual violence went unreported. And even as they went unreported, they never received any services whatsoever. And this went ahead to predispose them to more dangers. I think, as you said, this is a communication problem. And once it is not reported, one does not get any support or referral services for that. I think your presentation presents a very innovative way of going about the problem by initiating a parent dialogue and screening students and sensitizing them. And also for organizing the goat eating for others. I know men like goat eating, and they are also very supportive when it comes to this. I would like we field around a few questions, maybe around 4 because of time. Is there anything that didn't come out well, or whether there's an experience that you like to share? Maybe to add up onto the ideas that she has presented. floor is open. All is well? You heard her? It is sunk? You have something?
Thank you, Chichi, for the question. My name is Leonard Chumo from Alice, South Africa. Not a question, an observation and an agreement. I may not fully agree that the problem is a communication problem, but I agree that we need to find a way to make the problem simple so that we can solve, rather than complicate it and make it complex. So thank you for me, that's a takeaway.
Okay. It's not a communication problem, but we need to work out and see how we can deal with the situation as it is.
Thank you very much, Doctor. My name is Agnes Wasike from Uganda, Impact Innovation Development Center. I like the simplicity with which you presented and shared the intervention. And for me, really true, it's a communication problem. And I wanted to ask, how did you get the teams that were involved to keenly observe, document and follow through so that the story and the jigsaw fits together so well? Because many of us, I believe, are doing good things, but we're not able to tell the story the way you've told. How did you do it? Thank you.
Very much, Agnes. Any other? Yes, this hand up and then here.
Thank you. My question is very simple. It's all well and good if you have a team who understands the assignment and does this, but on a broad spectrum, because where you have education, the child protection services, the livelihood of the child, how do we use communication to collaborate all these agencies that are around the child? For me, I think that would have a bigger impact in targeting many children instead of, a cluster of children. So it's how do we use that information, that communication to bring together the link of organizations to work in partnership for the child?
All right, thank you.
Yeah.
One more.
Yeah, one last one. Dr. Chichi, Samuel here. Thank you for a very great presentation. 2 quick points. One, for the benefit of the men here, so that we are not thought to only have come for the goat. Is it the goats that brought them, or because it was a men's only? And linked to that, is I've been in programs that have talked about men involvement, and we've said it many times. But in the last about 20 years, I see it like a ping pong, it looks like it depends on the funding. Is it really true that the men are not being brought to the table, or is there something more than that? Is there a way this can be seen more from a communal point? And let me give you a very quick example. You may not answer it now because of time. We have a project with some partners in Somali, and they say the way they've done a more punitive or a more, let me call it punitive approach to addressing sexual violence is the clan pays for a case. If a man defiles a woman or a child, it is the entire clan that pays, and they find that more punitive than sending this man through the justice system, the legal justice system, which just him will feel like they've got to pay for that. I don't know what your experiences are around what really makes male involvement effective. Thank you.
Thank you very much. And we're not going to entertain very long questions. We need to be very short, precise, to the point. Thank you.
Thank you very much,
You're
Dr.
taking notes. You're taking note of them? Okay.
Thank you very much, Daktari. My name is Julia Enoi. I come from Kisumu County. I just want to ask about the counselors in school. How long did they stay in school for the children to open up to them? The matters of rapport, how long did it take to build the rapport? And what methodologies did they use for the children to be able to open up to them, unlike the way they would have opened up to their own parents?
Thank you very much. What methodology did you use so that they opened up? We have 4 minutes. Any other question? I think we can. You can just take those because I think you're not writing them anywhere down. Yeah, please.
Thank you very much. Great questions. I will try to remember the ones I can. Let me start with the first comment, which, in some ways I agree with. I've deliberately made a very complex issue seem simplistic, but I still would argue that no matter what intervention you're thinking of, no matter what solution you're thinking of, there has to be some level of effective communication for it to work out. I think, that we just can't get away from that. And that ties back to the question about, how do you engage, in a multi-sectoral fashion, in a way that is effective. And there are all kinds of groups that are set up to do this, but it still boils down to, being effective communicators, and communication isn't always necessarily about talking alone, it's also about targeting. This is why I asked, do we have communication majors here? Because there's so much I think you learn, in that field that is very applicable, to many of these questions. So I don't know if there's a magic bullet for communicating with, stakeholders, but I know that there are all kinds of collaboratives between sectors set up, and oftentimes we do our interventions, we begin them and we plan them without being aware of what already exists, that we need to tap into, and then we find out maybe when it's much too late and then there's no buy-in. So some of it is about, just even having a communication strategy before you begin to communicate and figuring out who are the right people to begin to target and talk to. There are all kinds of technical working groups that bring together these different sectors. The question about, the psychologists and, how long it took to build rapport, great question. One of the things I didn't mention, but which you'll find in the publications, is that we did 2 rounds of screening in each school. And children were much more likely to disclose in the second round than in the first round. The second round was for those who were screened once and said no, they'd never experienced this, which is fine, not every child has, but we made sure we did a second round, and through that second round, we were able to get even more children. Also, it was really just about being there. Just the fact that the psychologists became part of this fabric of the school, children just were comfortable and came in to talk about things like, we'd love to start a girls' club, can you help us? Or we'd love to, boys would come in and say, we'd love to have a boys-only group where we just talk about sexuality issues. Can you do that, So it wasn't only about the fact that they were counseling, but just about the fact that they were there. The children took that as an opportunity to just begin to open up. I'm having brain fog now about some of the rest of the questions. How to engage men? I think that it just really depends on the context. If you had told me that goat eating would be so magical, I wouldn't have known. But in the context that we were working in, we asked them, how come everyone that came was a woman? Where are the men? We said this was a Parents' Day. Oh, that's what always happens. When you invite parents, just the women come. So what do we do to get the men then? They said, let's have a goat eating. So I was like, let's buy a goat for each school. We'll figure it out, in terms of explaining it to the donor, right? But it worked out really well, right? So I guess it just depends, and we have to be prepared to understand that, this is nothing new to any of us. Every population needs its own strategy, for targeting. I think there were some other questions that I don't seem to remember now. Please come find me. Happy to answer in person. Thank you.
Thank you a lot, Dr. Ari. I think you've covered most of the questions, and thank you for taking us through this session. For sure, I know as Kenyans, discussing sexual issues, even within our homes, is a taboo issue. We don't discuss those things, either with our boys or girls. We leave it to either counselors, people in the church, people in the mosque, and we don't open up. But I think it is important we look at innovative ways of how we can have this discussion and to make the children be able to know how to express themselves, and especially when they are molested sexually. Thank you very much.
Thank you. Can I say one more thing? I know our time is gone up. Just remember the question about the methodology.
Sorry, just to say, it is a common problem. And I think that what is required is, we need more collaboration. It makes sense for practitioners, service delivery experts to partner with
research organizations and the like, because the question about, how did we tell this story so beautifully? I guess it came naturally because I work with a research organization, and our job is to track all of these data, to understand what's data and what's not, and to work with, implementing partners, because we don't know how to implement, that's not our expertise, but to work with them to draw out, these beautiful stories. So I think partnerships and not trying to do everything on your own is really key to ensuring that documentation is happening, in addition to really capacity strengthening for every organization in this area of documentation. Thanks.
Thank you very much. We can release you
because of time. I think we're going to transit maybe to the next session. I know there are the breakaway sessions. And big clap for her.
Do it the Kenya way. Tunafanya namna gani? Can we have someone who can appreciate her? Anybody?
Thank you, Dr. Chichi. Let's appreciate Madam the Kenyan way. The Kenyan way is that we must clap with a lot of energy, isn't it? And I will count 1, 2, and the third one, you start clapping. And this is the way you'll do it. 1, 2, 3. Again. Thank you. Just like that. Okay, that was a demonstration. Can you now go? 1, 2, 3. Again. Again. Thank you very much.
Kuna tukiyote zile za kushuna maua. But that one is well. I think we proceeded to the breakaway sessions that are being requested by Grusha,
who is seated there in the secretariat desk, for the presenters who are doing it here to forward their presentation to her. There is Nikuba Zia, there is Florence Kagweru, there is Fidelis Mudoni, Teresia Nyaolo, and Julia Enoi. Yeah, you may pass the presentation to her. Thank you very much indeed, and I look forward to meeting you in the breakaway sessions. Asanteni sana.
Session coming up for the next 2 hours. Let me just confirm that. All right, maybe no, 1 hour and 45 minutes. And we are going to be looking at evidence and programs and services. And we have, for us this session, we have 5 speakers. We have Nkuba Zia, Joanna, Edith, and Abdul Bachani. And they'll be speaking on utilizing cash transfers to reduce vulnerability, improve agency of caregivers of children with disabilities to support their families. And Florence Kagweru will be speaking on issues impeding efforts to mitigate vulnerabilities, predisposing children to violence. We have Fidelis Mudani, who will be speaking preventing family separation and promoting reintegration through positive parenting. We have Teresia Nyaoro, who will be speaking about Beyond Bars,
Clean Start Africa's approach to supporting children of imprisoned mothers, and finally Julia Enoy, addressing violence against children in Kisumu. So I just want to confirm
that we have all our speakers in the room. If time allows, I'll give them all about, we'll give them all about 20. Oh, great. I'm corrected that Paul Mugambi will be the one presenting on utilizing cash transfers. So, I'll ask, yes, I'll be timing you. When I show you your 5-minute mark, please just remember that. Now I want to take this opportunity to invite Paul to share his presentation. I think, do we allow you to present from here, or do you want to come up to the podium? Oh, great. Then.
Good afternoon. Good afternoon once again. Oh, I wanted to mention the voices inside here. My name is Paul Mugambi from Catholic Relief Services, which is an organization which has a project called Changing the Way We Care, which deals with care reforms. I would like to make a presentation about how cash transfer has reduced vulnerability of children with disabilities, a case study in Siaya County. It's a collaborative effort between me and Edith and Leah, and also thanks to the caregivers and persons with abilities on the ground who enabled us to have this information. So, to begin with this, I would like to talk an issue about data. And as we know that 2.2% of Kenyans' population are persons with abilities, according to the 2019 census. And when you find this data, when you relate to the World Health Organization, it doesn't augur well, or it is low. We can say it's a low standard. While we know the world currently in 2023, we talk of 16% of the world population being persons with abilities. We know that most of the time, persons with abilities are largely live in the rural areas. And according to our study, which I'm talking about, Siaya County is among the 5 counties which has highest prevalence of persons with abilities. And when you look at it, is that in one of the sub-counties where we work in, Ugunja seems to have a lot of persons with disabilities. So we find that Siaya County, we really need to seek ways of how we can have more intervention. And as changing the way we care, we try as much as possible to offer quality services, provision of capacity building to the local implementing partners, and supporting the organizations of persons with ability to have meaningful engagement, and also increasing our awareness, acceptance in terms of creating that awareness. Looking at this issue about cash transfer is one of the key issues. Why I really wanted to conduct this study is because I wanted to seek ways of how we can embrace the issue about individual autonomy and respect of a person with a disability making a decision. And we'll see how this study help us to understand how changing the way we care employed that issue of engaging persons with ability meaningfully to make their own choices in cash transfer. So when persons with abilities make their own independent choices, you can bear witness it can bring more impact than when we make decisions on their own behalf. So the unconditional transfer, you find that in 2022, Changing the Way We Care had identified 304 caregivers through peer support groups and case management processes. And they received a one-time cash transfer of $139. So through this receiving of this cash transfer is what now we'll see how the impact came to be in place. I'll explain to you. So some of them opted to buy food, some of them opted to buy assistive devices, food, medical support, shelter and innovation, and through that, some of them even started some business startups. The method which we try to use is through interviews and also conducting some monitoring visits of these households. Because one of the things is that when we had these peer support groups, we had asked them some questions regarding how they would like to use their money when they get it and whether they will follow up the whole processes. So we had the following outcomes during this assessment or after the post-assessment activity. We had increased participation of persons with abilities, business startups, confidence and also nutrition, and also referral mechanism. So you find that when persons with abilities are greatly honored in terms of their own support or being involved in individual autonomy and making choices, there can be a big difference. And I believe you have seen a sort of a photo through that PowerPoint where one of the caregivers was demonstrating how he was doing some of the business, and such things really improved the situation. And what I can tell you is that once you realize the importance of engaging persons with ability meaningfully, and you respect their individual autonomy, whether it is even at work or at different places, you will see better results rather than when we make decisions on their own behalf. So, as we know, the Convention on Rights of Persons with Disabilities and also the UNCRC talks about meaningful engagement or self-advocacy of organizations or persons with disabilities and their own representative. We really need to look into that area. Lastly, my school of thought is about us thinking how cash transfer can be made available to everyone. Because you see, the universal basic income help us to really enhance the reducing that issues around targeting, which sometimes we miss a lot of people. Sometimes we use a lot of resources when we look for this targeting. And also, universal basic income can also be part of reducing poverty. So I believe that through this Changing the Way We Care cash transfer, if it can be emulated, whereby you consult the real people, you get actual results. So we need to really look for more resources, and And we can conduct more research so that we can be able to enhance this issue around cash transfer. And we know that the world is moving towards looking for cash transfers so that we can support people to make their individual choices. I believe that through those few remarks, I can receive some questions because I have my airtime. How many more minutes, Madam Presenter?
No, you have quite a lot of time. You've done very well. Thank you very much. Please let's appreciate Paul's presentation with a hand clap. Yes.
You have about, you still have about 10 minutes, so you're good. And I'll invite any questions. Paul has shared with us why it is important to give persons living with disability the autonomy and conditional
cash transfer. Great. Please pass the microphone.
Hi, my name is Maureen Sharon Awino. I happen to be one of the caregivers. So I want to ask, my question is about the cash transfer. I'm very much excited on the cash transfer because if we check on ways of fund, the one that government is giving is 2,000, of which if it's 2,000 and we are buying Pampers, at the same time we are buying medicines. So for that 2,000, I don't think like the way you are telling us, like the caregiver said that at least the cash transfer can help in terms of the way she managed on her business with the cash transfer. I don't think if it can happen that way because it's 2,000 and 2,000. If you buy medicine and you buy Pampers for the kids, it's not going to work that way. So I wanted to ask about the cash transfer again. Initially, you guys did the selection of cash transfer, and according to the data, some of the caregivers were complaining. Like you find out the spina bifida and hydrocephalus, the disabilities cannot be noticed unless you see the kid with the wheelchair or you see the head if it's big. That is when they are being allowed to take the cash transfer, or they are being allowed to register. How are you guys going to go about it in terms of those who are not registered to get the cash transfer so that they may get the cash transfer? And how are you going to help them on the government to identify those kids? Because this is one disability that somebody can't see it unless they give out their doctor's recommendation and also their PWD's cards.
Okay, my name is Marvin
from Kisumu. I have some two questions. I wanted to know whether the money that you're giving to the people with disability, does it go
directly to those who are living with disability, or you pass it through the caregivers? And if it goes through the caregivers, what do you do to ensure that the people living with disability benefit from that assistance? Secondly is about the children who are living with severe disability. Is there anything that you do to ensure that they are linked to educational support? Because most of them are always stigmatized in the community. Some parents hide them and they are not able to access the help or the assistance that is needed. What do you do to ensure that such children also get an opportunity to go to school and also benefit from such programs? And lastly is about sustainability of the assistance that you're giving. Some of these people who are living with disability have some hidden potential or strengths of something that they can do to be able to get money. Is there any kind of economic empowerment that you try to advocate for, so that apart from that temporary assistance that they are being given, they are also able to get some sustainable support?
Wow.
I think you take those three.
Yes, first. Then I can cover the rest. Thank you very much for those great questions. And to begin with, is that I would speak on behalf of Government of Kenya, but I'll comment about it because we cannot run away from some responsibility of saying what it is. Okay, to begin with, changing the way we care coming from CRS perspective is that we had a one-off cash transfer activity, which we were working with the communities around Siaya County, which was targeting caregivers and children with disabilities. And one of the key issue here is that meaningful engagement, meaningful consultation is what took place. So we had that approach of participation, which enabled us to get those results. And when you look at this study, it tells you a lot in terms of when you involve the real people who are persons with disabilities and also the caregivers. Two, it is also a multi-sectoral approach. In one of our programs is what we call COFEC, whereby we train caregivers or link caregivers on training on finances and issues around entrepreneurship. And so within the Siaya County, we linked some groups of persons with disabilities and also caregivers and other vulnerable groups to such initiatives, and where they were also built their capacity. So we don't leave them that way only. Now, to the issue about why, in my remarks I've talked about universal basic income. Why I've talked about it is because I know that at the end of the day, government bears the responsibility for ensuring that all Kenyans get services or have the social protection, which is a right according to the Constitution. And as we march towards that dream of universal basic income, is whereby my thoughts, or the school of thought where I'm coming from, really, I know that persons with disabilities are the most marginalized, and also the caregivers bear the brunt of this issue, whether it is about therapy, medication, and whether you are taking care of, because you find that sometimes, most of the time, people come up and talk about caregivers of children with maybe autism, cognitive disabilities, while even other caregivers or children with maybe deaf, blind, persons with physical disability, they also lie under this category. But when you talk about cash transfer in Kenya, especially which targets persons with abilities, just a small number, 47,000 only, who have been targeted, and in September they were aiming to have that number to reach to maybe to 83,000. So at the end of the day, you know that even if we went with the census of 2019, which talked of 918,000, we wouldn't have done any justice to persons with disabilities. And that's why you are hearing me talking about having a universal basic income. Because I know once the government adopts that approach, all persons with disabilities will be catered for, and it will reduce that vulnerability which persons with disabilities are facing and their caregivers. I hope I have not left any question.
Thank you very much, Paul. I think we have a minute. We can actually take another question. Any question? Well, I could ask a question. Has your research shown that because of
this autonomy, then there is a reduction to violence? Is there any connection with, when we give this
autonomy and support with cash transfer, that there is a reduction on violence against children living with disabilities?
That sounds interesting because you see, once, if in case you want to understand how violence occurs because of many things or many factors, risk factors like poverty, like misunderstanding, mental health issues, such things. And if I can comment that through cash transfer, it has brought some more, let's say, unity within families, and also when people are engaged, I believe it reduces that violence which can occur. And when you look at the issue around violence, and when you talk about personal disabilities, when communities or family members engage with violence, obviously, you'll either cause another disability, or either you'll make that person within that person with a disability who is within that community to get another disability, or make this person to be more vulnerable because he won't get attention because of that violence which has occurred. So I believe that, or I know that in case there is such cash transfer, it can bring more unifying factor within the community. I forgot to say that for those who are in this house, I'm a blind person, and one of the things which I forgot to say is that during this conference, there are some aspects of inclusion which we really need to have adapted in terms of alternative mode of communication, whether it is Braille, whether it is sign language, or whether it is access of different places or platforms. So thank you very much.
Thank you very much. I can confirm we do have sign language. Thank you very much, Mr. Paul Mugambi. A round of applause for him, please. Thank you.
Great. Fidelis Muthoni, you're up next.
Florence here? Not yet? Okay, great. Fidelis, karibu sana. You have 15 minutes as well.
Good afternoon. Yeah, thank you for choosing to be here. I know there are many forums, but you chose to be here, and I'm happy that you're here. My name is Fidelis Muthoni. I work for Changing the Way We Care, and you'll hear more about it. So karibuni sana, sit back, relax, enjoy, and engage with this presentation. Oops. Oh, good. As I mentioned, I work for Catholic Relief Services, which implements the Changing the Way We Care initiative. And Catholic Relief Services was established in 1943. It's from the Catholic Bishops of the United States. However, CRS has been in operation in Kenya since 1965. And we have many projects. I won't dwell on that so that I leave more time for the presentation of the day. And you can interact and learn more about CRS from our website. So Changing the Way We Care is an initiative, and it's really just a summary of just that title. We envision a world where all children thrive in safe and nurturing families. For those who have heard the care reform, that's really our intention, to make sure that we reduce reliance on institution care and instead promote family-based care, whether that is biological or other alternative forms of care. And we do this through working with the government to promote family-based care. And also our work really spans beyond Kenya and beyond. So we have a lot of documentation and learning to influence national, regional, and global bodies. So as I mentioned, specifically in Kenya, we are working in 4 counties. We are in Kisumu, Siaya, Nyamira, and Kilifi. And much recently, we've started working in Mombasa County. And in some of these areas, as you will see, some of the areas we are working fully in the counties, while other areas we are just working in a few sub-counties. The data you're seeing here is really from our situation analysis, and I must say much of this data could have changed significantly or slightly. This was data from around 2020, 2021 of the families at risk we were supporting in those counties, and the number of children in institutions, charitable children institutions, or statutory children institutions, CCIs, or commonly some people prefer to refer to them as orphanages. So from here, you'll also see at the corner there, in many of these counties, as we work through our local implementing partners. So we were partnering with local implementing partners in those counties. When I mentioned Mombasa County, we recently started working there, and mostly in Mombasa County, we are implementing still work around care reform, but specifically with the Catholic Church. And just to mention, beyond the Kenya borders, the Changing the Way We Care project is also implemented in Guatemala, Moldova, Haiti, and bits and pieces in Zambia. So many of us may be wondering why positive parenting and violence against children, or VAC. Just to mention, many of the children that we find in our CCIs or in institutionalization have already undergone some level of abuse. You'll find a child who has gone through sexual abuse, they are rescued, and they are placed in institutions. So already many of them who may be in institutions have already undergone some level of neglect, discrimination, especially children with disability, and that's why they actually first end up in those institutions. Secondly, research has already shown, and many of us are already aware, that when children are living away from home, be it in the streets, be it in institutions, they actually are prone to more violence. And we've seen even some places, especially in CCIs, where children have been exposed to more violence, even when they were expected to be being put away there because to prevent them from abuse. The other thing we are looking at, when you go to these CCIs, we find a lot of children with disabilities. And the sad thing is, they would be the first people to enter the CCIs, and they will be the last people to leave CCIs. So we find that children who are probably have already been discriminated at home with disability, they end up in CCIs, continually exacerbating the issues of violence against children. The good thing is there is a lot of evidence that shows that reintegration or reunification, when it's combined with parenting, it has better results. These are studies that have been done out there to show that there is actually need to combine parenting with reintegration or reunification efforts. And lastly, many caregivers, even many of us here, really have the best interest for our children at heart. However, due to the stresses of life, you're struggling to put food on the table, you're stressed, you're tired, you find that many people, caregiving becomes overwhelming, and instead of being a really good caregiver, you actually tend to expose your children to more harm because of the stresses of life, of actually just providing food, caring for your children. So for changing the way we care, we don't do parenting in isolation. It's really not a standalone intervention. Instead, it's in a model of family strengthening. And when we look at family strengthening, we are looking at a combination of activities or interventions. So for us, as changing the way we care, when we refer to family strengthening interventions, we are looking at beyond parenting, we are looking at household economic strengthening, we are looking at life skills for caregivers and children, we are looking at linkage to psychosocial groups, we are looking at cash transfers, particular support to caregivers or children with disability, etc. And so just to mention, parenting programs have potential to reduce VAC. However, combining parenting with other household economic strengthening activities has greater results. For those who are here in the morning, Dr. Digolo presented that very well, that when we are able to address some of the stresses in the family, for example, providing food, cash transfers to alleviate some emergency, really has better effects in preventing VAC in the household. We've also, beyond providing those things, we also recognize that many agencies, we don't work in isolation, that there are other partners who you can link and refer families to. And also addressing household economic strengthening activities or other family interventions
really helps caregivers reduce stress that can cause caregiver stress,
and that's what I've mentioned before, and really cause caregivers not to be mentally well. And we've seen when caregivers are mentally well, when we've reduced the stress for these caregivers, then generally families tend to do better. So some economic well-being activities actually lead to reduced workload, thus freeing more time for caregiving. When caregivers are supported with household economic strengthening activities, they don't have to spend so much time fetching firewood, fetching water, and doing other chores. And that makes sure that they have more time to actually attend to their children, thus reducing cases of neglect or even sending their children for child labor and such other things. So just to mention that supporting reintegration and prevention separation of children have actually been seen to work better around family strengthening. And what you can see in the small font is in one of the papers that are the kind of research that we'll be presenting here. Many of our caregivers, when in the work that we've supported reintegration, we saw many caregivers were reintegrated back to their very elderly grandmothers, and many of them were from, they were widows or widowers. Just to mention, and when we have widows and widowers, we already recognize the issues of poverty around that, just to really emphasize the need for household economic strengthening. And as I've mentioned, for us, parenting is really a holistic approach. And what we are looking at here at the primary level, we are saying everyone could benefit from parenting. You do not have to be a caregiver who is receiving a child from a CCI or a caregiver at risk of separation. Everyone could benefit from parenting. So for us here, this would look at intervention targeting all families in the community, and this could be in the manner of just sensitizations around the importance of positive parenting, sensitization about the need to reduce corporal punishment and the like. However, as we move up, we are having now more targeted support for the families at risk of separation or even those ones from reintegrating families. So for families at risk of separation, this could be families that we've already identified to be having risk factors. For example, maybe the biological parent of that child is really young, or they have alcoholism, or maybe the child has been dropping out of school severally. So they are already showing risk factors that may make them separate with the child or take the child to a CCI. So those are the ones we are calling caregivers at risk of separation. So for such caregivers, they are still with their children, and therefore the need to promote positive parenting. So in this second level, much of that is done in groups where we form parenting groups, and many caregivers at risk of separation, some from the community, form parenting groups, and they undergo parenting. The last level, where we have the fewest number of caregivers, are really an approach to enable reunification and prevent reseparation. These are the caregivers who probably we've identified they're in the process of reintegration, and here we also use case management. It's beyond offering parenting, but also really working with that caregiver, following up on their case plans to ensure that that child is reintegrated and properly settled in the home, and also following other issues identified in the case plan. I must mention at this level then there is a lot of also household visits to make sure that the child is really well reintegrated in the community or in the family. So to speak much more broadly about our positive parenting, we call it Families Together, and the reason we call our parenting program Families Together, because the aim is really to bring families together, where a child was separated from the caregivers or where we are preventing separation. So when I talk about families together, just know that that's our positive parenting program. So we often have seen the need to support transition back to families, and we know that many curriculums that are out there for parenting, they are actually done in a group setup. However, because of our unique situation, we saw the need to actually adopt some of these parenting interventions to fit in the unique needs of a reintegrating family. While it's very easy to form parenting groups in a typical situation, for reintegrating families, that is not always the case, because a child may be moving from a CCI and they need to be placed somewhere far. So that is why we tweaked our parenting program from skillful parenting to make sure that we also had sessions for at home. So we have parenting sessions in groups and also at home. And also we needed to couple this with case management, as I had mentioned, and also combine with other family interventions. I've already talked that our parenting sessions are not done in isolation, but they are combined with other family strengthening interventions. So the Families Together curriculum, the sessions are done by trained caseworkers or community level workers. The trained caseworkers are also following up on other issues in the case plan. And for us, this was key because we didn't want many people visiting the same house, following up on parenting, following up on birth certificate, but that one person is actually the one who does parenting and follows up on the other issues. Sessions can be done at the group level or at the individual household. I've also mentioned where some cases cannot join groups, but if that's not possible, then we have groups and household also to meet the needs of male caregivers who generally do not like being in parenting groups. And then pre and post tests are also administered at the beginning and at the end. And for us to consider you that you've completed the sessions, you need to cover at least 6 of the 8 modules. At the end of each module, you receive home activities that you do at home to make sure that we increase adoption of behaviors. Quickly, let me go through about some of the results and evidence. What I'll focus on is we did a household survey in 2021. And in that household survey, we saw 70% of the caregivers had received parenting training, really showing that people appreciate parenting. And of those who received parenting, they actually rated it as the best intervention, second after cash transfer. So cash transfer was what they termed as the best intervention, followed closely by positive parenting. And then 67% of those caregivers also said that they had started, they were actively involved with their children in practicing some of the strategies. They would praise their children, they would reward them, they would compliment them. They were involved in the lives of their children, which for us is key, especially considering many of those caregivers had just received their children from CCIS due to COVID. And they were also not using corporal punishment. They were not hitting, they were not spanking. And just to mention that older caregivers of that study, older caregivers were less involved. However, they were the least likely to use corporal punishment. And majority of our caregivers were very elderly. On the pre and post test, as I mentioned, we also do a pre and post test, and this is purely for knowledge to see as soon as you finished your parenting, what is your knowledge retention? Are you able to understand issues? And you can clearly see soon after the 8 weeks when you finished your parenting, you do a pre and post test. And these are some of the statements we've picked from we have a 14 question statement kind of questionnaire, and you can clearly see that there were immediate understanding of issues around violence, prevention and reporting of violence from the caregivers immediately after receiving parenting. Yeah, I have like one more slide to go. It's not moved. Oops, sorry. Yeah, and still from the household survey, I just want us to focus on these two. For the children at risk of separation and those who are reintegrating, when we did the survey, again, I mentioned this was in 2011, many of them said they felt safe and nurtured. And for us, safe and nurturing means these were children who are above 11 years old who are asked whether they feel safe and nurtured, and we are looking at, do they get time to rest? Are they treated well in the community, the same in the family, the same in the community? Those are some of the things we were looking at for them to actually say that they felt safe and nurtured, and we were linking this back to caregivers who had actually received parenting. Some of the distance challenges we've seen is the long distance for reintegrating families. Many caregivers are not literate, and you understand parenting, our curriculum is in English. However, the facilitators do that in the local language, and also many of our facilitation techniques do not cater for caregivers with disability. And lastly, on the areas for research, we are saying we need to look further on layering of interventions, especially with household economic strengthening interventions. Is it parenting plus cash transfer? Do we start with cash transfer, then parenting? And we've seen implications on layering on that, which we can talk much more later. We've also said parenting programs could be general. However, there is need to tweak our content and our modalities of doing interventions, especially for elderly, very elderly caregivers, very young caregivers, and also for caregivers. Caregivers mostly have not seen parenting modeled to them. How do we expect them to model parenting? And lastly, we need to gather more feedback on what degree of family strengthening interventions are addressing push factors to the CCI. Yeah, thank you so much.
Thank you very much. Better hand up for her, please. Now, so should we get into your time for questions? So I'll only allow 2 questions from you, for you. Any question? Very elaborate presentation about the program.
Thank you so much, vision in being the alternative care. So my question is that I heard you identify the CCIs and in this statutory institution where you work one-on-one with them. So my question is like children which are committed in this institution, most of some from the CCIs, some do not have parents, some were abandoned, and some may be back at home, parents are not there at all. During integration, where are we going to place these children? Sometimes the family has rejected them. One, in a case where a child who was born out of wedlock, the parents disappears, or maybe one of the parents is dead, or both parents are not there. Where will you return this child? In the community. Sometimes even the land had been divided by the uncles and cousins. What are we going to do to sustain for the sustainability? It is a good plan for us to reintegrate children back to the family because of how they are being brought up. But how are you going to make a sustainability on these children? Thank you.
Thank you so much. Thank you for your presentation. My question just or concern goes to independent living, these children that are now older, your inclusion for the single independent living, and then how do you select CCIs that you want to work with? Thank you.
Hello, I'm Colin Sahali, and thank you for a wonderful presentation. I only have 2 questions to ask. One, do you provide a booklet or a written material that could be used in the schools during the lessons of life skills education? 2, what are the mitigations in place to support children whose guardians or parents are violent or authoritative? Thank you.
Thank you for the presentation. I'm requesting you could take back to the slide that you are showing the places that you are working in it. The one with the Kenyan map. Yes, on Siaya County, I can see there are like 1,040 families at risk.
what are the interventions as an organization that you are taking to prevent those families at risk? And also I can see there's a large number of children in institutions. What are some of the interventions as an organization that you are taking? Thank you.
Well, thank you for the questions. We literally have 1 minute.
Okay, there are quite a number. So for children who don't have families, yes, that's a reality. However, just to mention, one of the things that we saw, especially with COVID, is that when the government closed the institutions, many of those institutions and the children actually went to some relative. So I want us to begin from that fact that many of the children actually have a relative that they can go to. However, in instances of abandonment where children don't have a relative, we start that, first we start with the tracing with the support of the sub-county children officers, with the support of the CCI staff, and if those are not there, then we explore other forms of alternative care where the child really doesn't have to go back to their biological family if that biological family is not there. So in terms of independent living, I must admit we've not done much with independent living. However, much of the work we've done is really supporting caregivers, some caregiver interventions, be it with life skills, psychosocial support, sometimes also with cash transfer. There are also some of them who join some of the parenting programs. In terms of selecting CCIs, in each county we were not working with all the CCIs, but through the support of the DCS, we selected some CCIs. So we didn't work with all the CCIs, again, because of the time limitations and the finance and resources that we had. So in each of these counties, we actually have not worked with all the CCIs, but the selection was guided by our government colleagues. For the schools, some of the interventions we have directly going with to the children is that we have the life skills, which we work with the Kenya Society of Caregivers. For those who would want to interact with them, you can search for them. So we have a life skills program, complete with manuals and handbook to support children all the way from 10 years to 25 years. And for mitigating parenting who are violent, I must say beyond parenting, we cannot continue keeping children in unsafe environments. And this is where really reporting cases of abuse are relevant and allowing the government colleagues who are very well conversant with that area comes in. So there are reporting channels, especially when caregivers are violent, and we refer them to sub-county children officers to support that. Lastly, on the question on the families in SIA and some of the interventions we have for the families at risk of separation, there is parenting. We have SILK. SILK is a saving and lending methodology. We have cash transfers for disability, supporting disability. We have a whole list of interventions. We have training on financial education. Yes, those are some of the things that come to mind for now.
Thank you so much. Fidelis, let's clap for her. She takes her seat. And as we invite Senora from cash transfer and preventing programs to Beyond Bars. Karibu.
Good afternoon. My name is Teresia Nyauro. I work at CleanStart. At CleanStart, we are an organization that works with women, girls, and children who have been impacted by the criminal justice system. So we work with the girls who are in Dagoretti. We do mentorship for the young girls, the ones in Dagoretti, and then the ones in Kamai, we also do mentorship. We also have a program for children of incarcerated mothers. I know there are some people who don't know that we have children in prison, and we do a program there for those children who are 0 to 4 years. So this presentation was done by a colleague called Leila. Leila is our staff, and she's a child of an imprisoned mother, and I'm here to honor her work. I am her lead when it comes to program. She's now an advocate. And that is one of the reasons we continue to support these girls. We continue to support children of imprisoned parents so that they can become the solution bearers. So I'm here to honor her this afternoon. She's actually in a conference in Machakos. She's a practicing lawyer. And in our department, in our organization, she's the legal officer. So let's go to, so Clean Start, first and foremost, we were planning to have a training, to do a physical training with the prison officers. We know that our children, the 0 to 4s are in prison. Their mothers are there, most of them, 90% of them are children of single mothers. And we know that a lot of these cases we are actually receiving as the last step of the conveyor belt of the violence, then going down, and then you find these women in prison, especially for petty offenses. So the girls, the officers there, we decided to trade, and we worked together with an organization called Kidogo Partnership. That is the importance of partnership. They do a lot with work with women who are in the informal settlements to support them with caregiving skills. So we worked with them, and while we were planning to do a physical training. But as fate would have it, COVID hit, and we would not stop at that. We still thought, no, we have children inside, we still have to do some interventions. And that is why Leila wrote this, because we thought of what else could we do. And at that time, we would not be able to visit the prisons. So we did virtual trainings on responsive caregiving. So Clean Start responsive care program addresses unique challenges faced by children of imprisoned mothers. The initiative focuses on training caregivers and including prison officers, imprisoned mothers, that is the ladies who take care of the children, to provide optimal care and support for the children within the prison's environment. You know that violence is a lot in prison, so we thought of a way of cushioning the children, intervening in their lives while they are still there, as they wait to transit on the outside. The program adopts a child-centric approach, prioritizing the needs of the child, 0 aged 4, accompanying the mother. The initiative values the well-being and the growth of these children, granting them access to crucial services like education and counseling. So our methodology, first and foremost, we knew that we cannot empower the women without, first of all, handling the officers. Therefore, we sought for permission to sensitize the officers, ranking from the top going down, so that the information that we're giving the women is not watered down. So they are able to understand why we are training the women, and they're also able to understand the context of which the women are being trained for, and also they are able to also receive the same skills because they work with children within those spaces. So I'll jump on that. So the evidence here is that with our partnership with Kidogo, knowing that we were not able to visit there, we thought that that was the end of the story. We were able to train 5 prisons. That is Langata, Nyeri, Thika, Machakos, and Moranga. They sent in their officers and we were able to train them. The training mainly focused on responsive caregiving because we wanted them to embrace it so that they can pass it on to the women who are given the responsibility to take care of children in prison. So the outcomes, the positive outcomes include notable attitude change among the officers. They too have their children, and they would want to feel safe. So there was change, recognition of the program's significance, and when I talk about that, I mean after the training, now people are aware that we have these children, we need to come up with a curriculum. And now it's a conversation, and we are hoping to develop a curriculum together with other stakeholders to work on these children. There was mind shift change, and a unified approach in specific prisons, emphasizing equal care for all children regardless of the mothers. So we work very closely with the Kenya Prison Service, and they embraced it. And in some instances, when we went for follow-ups, we found out that the children there were, some of the officers of the children of the officers were actually in the same daycare with the children of imprisoned mothers. For us, that was a big thing. So some of the challenges we faced during the virtual program, of course, at that time we would not be able to do follow-up because they were closed up, and so those opportunities were less. And then we noted that most of the officers that we had trained are being transferred, so that knowledge kind of disappeared somewhere into a different space, whereas it should have been used in that specific space to empower those who are there. The limited, of course, issues to do with the virtual platforms, the interruptions, the constraints, and other limitations that were there due to the pandemic. So in our recommendations, we recommended that we prioritize training correctional officers before we do the incarcerated women, because then the knowledge will flow from up down, not down upwards. It will be easier to sustain. We also said we explore hybrid models combining virtual and physical, because when we go virtual, we're able to reach so many prisons at the same time, and therefore sharing the knowledge becomes much easier. We also need to include hands-on. Actually, that was the big takeaway, is that for a training such as responsive caregiving, it's good to be practical. So that is something that has held us, and we are hoping to pick up from there. And also to celebrate success stories, to foster culture of continuous improvement. That is what happened in some of those trainings, is that each prison was able to share their best practices. So they were encouraging each other. Even if you do not have enough resources, what can you do to support these children? And so it was more or less like a competition. But at the end of the day, it is the child who won, because the space became safer for the child. And establish feedback mechanism for ongoing program relevance. So in conclusion, the positive outcomes highlight the importance of continuing the responsive caregiving training. In collaboration with prison institutions, it's crucial to expand its reach, benefiting officers and those who are incarcerated. The collaborative approach aims to create more supportive and informative environment, ultimately improving care and support provided to the children within the prison system. Thank you for listening to me. I hope I have used my time well.
Thank you so much, Teresa. Please let's clap for her. Really appreciate you. Used your time very well. Any questions for Teresa? She has about 6 minutes for questions.
As I said earlier, my name is Marvin Lois. I heard you mentioning that 90% of the children are from single mothers. But we all know that when there's a child involved, there must be two people who came together and engaged in some sexual activity. Is there any forum where you have brought the men on board, the fathers to these children, and told them about their parental responsibility as per Section 53 of the Kenyan Constitution? And who are the fathers of these children? Are these women impregnated by the same people in prison, the men, or are they the staff in the prison? And how have they been engaged to come together to exercise their parental responsibility?
Well, thank you so much. First and foremost, prison is restricted. So what we did was a research, and the women who we handle, who have gone through our programs, we have actually seen that they are 90%. The men, in most cases, when the women come out, they don't find the husbands. They have ever moved on or married somewhere else. So that is a statistic that we got from the women that we have been able to work with. So, and again, what is limiting us is our vision. We work specifically with women, children, and girls. So that is our area of influence. Not that we do not want, but that is the space that we have started on. Yeah.
Thank you. Next question.
Thank you. My name is Clinton, and thank you for the great presentation. One, the children of incarcerated parents or mothers. I believe 0 to 4 is a critical age of a child when it comes to developmental milestone. So at this point, we are still struggling. Do we foster these children? If we need to give them the alternative care, do we recommend kinship at the same time not disadvantaging this child? Because this child still depends on the mother. The mother is, the mother plays a critical role in the developmental milestone of the child, maybe even development of speech. Again, the environment at the prison, does it support the developmental milestone of the child? So I really wish you advise us. You have been there. So which is the best alternative care for this child, without enabling this child to pick the vices from the prison and also just to enable this child to develop like a regular child?
Thank you for your question. It's an important one. However, when a child is there, the little that we can do is what we did, is to support the caregivers with skills of caregiving, just so that they can have positive outcomes. Another thing is that we are lucky in Kenya that we have the mothers with their children so they can bond, because again, separation has its own issues. So that during that time, the mother is able to bond with the child, and the child can grow. While the child is still there, they have 4 years to prepare. Only and unless there is nobody from the outside who can be able to come and take the child. So the mother has the right to choose who will take care of the child as a caregiver on the outside. And that she's supported by DCS, she's supported by Kenya Prison Service to see how, to see that the child is taken care of. And only in a case where the family members are not able to come and pick the child, then we can use the other alternative methods of care, either kafala or, all those other alternative care through case management. Yes.
Any other question?
Okay, thank you so much. So, what is your, ways or input that you want to put in place for the long term, like if this woman or the mother is life prisoned? Thank you.
So, if the mother is in prison for life, the alternatives, the one that will be most appropriate for the child, with the best interest of that child. Is that okay? Like, you cannot put a blanket one, because each case is unique. There are different situations that call for different interventions, but what will work best for that child? And it's not a one-man thing, it's a multi-sectoral issue. So we have somebody from the DCS who's taking care of that. We have somebody from the Kenya Prison Service, and we also have the mother and the family. So it's a whole talk around that. Yes.
Thank you. Just a quick one. I know you mentioned something about some of the reasons why they ended up in prison in the first place were very menial reasons. Can we not look into that as well? Or is there a department looking into that to sort of reduce, that number of young women who are mothers to be in that sort of environment in the first place? What preventative ways can we look into?
So, as an organization, we are really out there. We are really out there advocating for alternative sentencing, so that the mother, it just becomes the last resort for the mother to go in. We don't separate the mother. We are also sensitizing the public through what we do. And like even next week, we shall be having a Beyond the Bars conference where all the women will be coming from different counties, different countries, and then have conversations on how do we not go back to prison and how do we empower each other as women so that we do not find ourselves back there, knowing that the majority of them are inside there because of poverty-related issues. Yes. Thank you.
Brilliant. Thank you so much. Please let's clap for her once again. This particular topic is very interesting. There's quite a lot of research. And actually, I'm looking for her. I was hoping that she's here. Madam Florence, who is the Deputy Commissioner General of Prison, is actually in this conference.
Yes.
And hopefully tomorrow, maybe we can ask her some questions because she'd also be able to advise further. But thank you for what CleanStart is doing. Really appreciate you. Thank you so much. We know, let's take the last presentation. And then if we have some more time, then we can allow you. You want to give a comment?
Thank you very much. My name is Eunice Mora. I work with the Directorate of Children's Services at the headquarters. I want to comment about children of incarcerated parents. There is a lot we are doing right now. We are developing guidelines that will help us safeguard the rights of these children who are in prison, and also those who are at home, whose parents are in prison, they are at home, or they are in statutory institutions or in charitable children institutions. Again, we intend to carry out an assessment on these children, and this is a survey, and I'm calling upon partners who want to be part of the technical working group that will be carrying out the survey or the collection of data on these children to get in touch with me or Terry, and we will work together as we help these children of incarcerated parents. Thank you.
Great, thank you so much. All right, now we go to our last presenter for the day, Julia Inouye, who will be talking about addressing violence against children. Thank you so much.
Good afternoon, ladies and gentlemen. My name is Julia Inouye. I'm a child protection officer, the Directorate of Children's Services, based in Kisumu County. I'm glad to be here to talk about addressing violence against children in Kisumu County, and specifically, I'll be focusing on family strengthening. So violence against children is widespread, and it's a problem all over the world. Statistics show us that globally, there is 1 billion children exposed to violence. And in Kenya, according to the 2019 survey, we see that there is 49% of boys and 51% girls who are exposed to violence. And as we can see that the violence is not only a human violation, but it also affects children both physically, psychologically, and emotionally. Apart from that, the survey also indicated that children who are exposed to violence normalize it in a way that they either become perpetrators or victims of the same violence. So for us, that's a big thing which needs to be addressed, and that's why we're seeing that it's important that we move away from reacting to the violence, but rather bringing a preventive approach to violence against children. So why family? Why are we focusing on the family, on the issues of violence? It's because it is in the family that children are socialized. Family is the basic socialization place. It is in this family where children belong to. It is in the family where their children have identity, it is in the family where children learn values and morals. So it is important that we work with the family to prevent violence. And in the same families, we see that abuse also happens in families. And families with strong background, families that are intact, families that value children, the level of violence in such families is very low. And that's why we're saying that the nature of families currently has changed. Why has it changed? Because of modernization, because of globalization, because of many other factors. So it's important that we work on strengthening these families that have weakened. Remember, weakening of families brings about disintegration. Currently, if you have listened to the current talks, we're saying that there's a very big statistics on single mothers. Single mothers have increased, so children are growing up without fathers. And even those single mothers, some of them go to work very early in the morning, having limited time with their children. Others leave their children with elderly caregivers. Hence, we realize that children have very limited time with their parents. So it is important for us to focus on strengthening these families and how do we do it? We do it by getting programs and intervention aimed at enhancing the well-being of these families. We want to build family resilience so that the functioning of the families come back to the way it was, to be able to take care of the children. Sorry. I think I picked it off. So strong families act as preventive measures against various social issues, including violence against children. And as I just said earlier, that research has shown that children raised in stable, supportive family environments are less likely to experience behavioral problems and are open to report any form of violence perpetrated against them. As Dr. Chichi talked here, she was saying that children can be abused out there but are not able to tell their parents. Why? It's because they don't have the connection with their parents. So this strengthening will be important to bring about parents who are able to relate with their children, not as fathers and mothers, but rather as friends, so that a child is able to open up to you. And that will only depend on what are your parenting styles. So there's thus need for families to be strengthened, to have capacity to adequately provide nurturing care for the children, and this will be built through strong family relationship and good family functioning and well-being. So the context of Kisumu County has 7 sub-counties with a population of estimated of 1.1 billion. It's 1 billion, the figure that is there. That is according to KNBS data 2019. And children make about 50% of that population. Most of these children come from very vulnerable backgrounds with many unaddressed underlying issues that expose the children to violence, and that is confirmed by the CPMS data. There was thus need to focus on the household to cushion them against the economic shocks as well as problems that strengthen relationships. So these are just ideally the kind of interventions that we put. These are family strengthening interventions. Family strengthening is ideally coming up with the support to families that helps them to be able to provide nurturing care to the children. So for our interventions, number one, as you can see, we have positive parenting. In that, I know you will have a question on that, but the data was interchanged. 726 was for females and 57 is for males. If you ask why, it's because as my other presenters have said, sometimes it's hard to bring men on board in matters parenting. But we're really trying so that we have both parties on board when it comes to parenting. Then income generating activities was 256, and I have not specialized whether it's male or female because this one was targeting the whole household. That is, for females we had 36, for males we had 370, a total of 406. The child optimized financial education for 21. Smart skills 23, 196, a total of 219. Life skills 504. Allow me to talk about life skills in matters household strengthening. When we the current generation or the current families have very many issues that need to be addressed. So we're realizing that many challenges that children face or rather family face is because of lack of life skills. So it's important that we bring these children on board, plus including their families, so that we can train them on matters how to take care of the problems, how to manage stress, how to control their anger, and etc. The other interventions are there. Cash transfers for families at risk, we had 343. The disability kitty, 103. This is because we realize that children with disability are often left out in matters. You will also find that some of them are left in institutions and they are last to come out and most likely first to come in. We also have emergency cash transfers. Those were during the COVID time. Income generating activities, 256, kitchen gardening, 270, and lastly, the targeting of household in the Inua Jamii listing exercise that was just conducted, we targeted 400. We're doing this so that you can cushion these households, empower them to be able to take care of the children. So the impact, how has this impacted? How has the intervention impacted on violence against children? We think that the number of cases for violence against children has dropped, and this has been confirmed by the CPMS data. We also have children within the targeted households have been able to access their needs, basic needs, including going to school, which has reduced the likelihood of them looking for services in other places where they could be abused. For instance, some girls go out to look for pads from border riders. So if we're able to get this, we mean that instead of them going to look for pads from men who would abuse them, they're able to get these services in their own households. And that in itself reduces the VAC. What worked well? We had the presence of great-willed partners who have been ready with support in terms of resources, proper coordination from the Directorate of Children's Services, both at the county and sub-county level, well-trained community workforce with skills to identify families at risk, make referrals and monitoring. There have also been capacity built as parenting experts who are able to engage caregivers on parenting sessions. There's also proper case management, including assessment to determine families at risk. Conclusion and recommendation, we're saying that addressing violence against children will require more attention to be given to prevention measures, just the way I said, that there is need for programs to ensure that their families are capacity built to prevent, identify, and protect children from violence. These will also require a multi-sectoral approach. We need all of us to come on board to be able to address the issues of violence against children. There's also need for more resources to be pumped towards family strengthening, because a strong family will always take care of the children. And if we focus on strengthening the families, we'll be able to deal with the problems of VAC. There is need to continue capacity building community workforce, including child protection volunteers, lay volunteers, and community health workers. And finally, that is just like a small quote from me. When you are hungry, your family feeds you. When you are lost, your family leads you. When you are afraid, your family keeps you safe. Family is everything. Thank you.
Thank you so much, Julia. And now time for questions as well. She's done very well with time. I'll go first. I'm hearing a lot of conversations around family strengthening. There was a Justice Needs Satisfaction survey that was done in 2017 that revealed actually a lot of the cases in court are around family. And so therefore I am particularly interested in this positive parenting, family strengthening programs, because once we're able to address this huge gap, I think we can reduce this what we keep calling case backlog, and let the courts and the justice system address what it does need to address. So good work to DCS and to all the other partners. So I'm opening up the floor for questions for her. And if you have a bit more time, then we can open for other questions. Anybody? A question? Going once? Twice?
All right, Julie, it looks like you made a very good presentation. Once again, please let's give her a round of applause. And we have about 25 minutes, but I can open up for conversation around what you heard this wonderful afternoon. For other partners who are working around the same issues or topics, and others who would like to ask
for other forms of interventions towards violence against children. Any interventions, any additions, any subtractions, any comments? All right. Oh, there is a question there.
Good afternoon. My name is Ahmad Al-Hadi. I'm from Ladakh, Garissa. So I've been listening keenly all the presentations, but I've observed as I'm working 7 years almost in child protection in TDH. So I would like to ask you one common question to most of the presenters that I have not asked mostly, but I want to ask them in general, and one to DCIs, that's Doctrine of Children's Services. So my question is that there's contributing factors to most of the child violence against children. So that contributing factors to displacement or neglect of children are, for example, drug abuse or families who are not comfortable. For example, if the father or the mother or one of the parents is drug addicted, that environment is not conducive for children growth. Second, so how does implementing agencies or all the NGOs or all child protection officers or actors, how are they going to handle that? Second, because of drugs are most affecting or contributing factor to that. Second question is that how is the government or implementing partners or all these agencies are planning to go against the other contributing factor, which is poverty, because of most of the mentioned that if regions raised that there's the most contributing factor which causes child concern or child issues or child neglect or all that, they say, they always in the middle and say poverty is there. So what's the government plan or agencies to do at least, because we know most of the African countries are facing the same challenges. The third one is that there are some laws that protect children, but mostly in the Constitution of Kenya, in all that laws, but mostly they are said and they are written, but not implemented by action. Because of most of the cases when child defilement or all that happens, there's also some other factors that mostly face the agents or the government. That's called people solve cases, Junior Maji. They just solve down the line and then the cases will be lost in the middle. Will not reach the final judgment or the final decision so that the perpetrators to be the good example to be done. So that's my 3 questions. Thank you for the time and I'll appreciate it.
Thank you, Ahmed. You said the question is for DCS. So the Julia and your colleague, you can respond to that. Any other questions, comments, reactions for what we have heard today in the afternoon? All right, we can allow Eunice or Julia to respond to the question. Thank you. All right, sorry?
She didn't get the question.
All right, there are 3 questions. Ahmed, do you want to repeat or do you want me to attempt to repeat? So the there's a question about addressing, the contributing factors to violence against children, and from the Department of Children's Services, what it is that they're doing practically. And also, I think there was a particular focus also with children who are living as refugees as well. And what is it that we can do to ensure, because he's saying that there are laws already, and there are very many laws, but at the implementation stage that there is a clear gap of implementation. What are the programs that have already been set up to enforce this? Julia, Eunice? Anyone?
I will just have us attempt to answer the second question, the one on refugee children. So ideally, children are children and all of them deserve to be protected because we have the principle of non-discrimination, ensuring that all children get services despite their ethnicity, nationality, or any form of disability. So we rescue, in case we come across a refugee child, from my area, that is, I don't work in refugee setting, but in case we come across children who are asylum seekers or refugees, we work with other partners like the Department of Refugee Services. We network. If they need refugee status, we link up to them. But if there is any service that they need in form of rescue or in form of service that we're able to link up with other partners, we ensure that they are provided with. But ideally, we do a lot of linkages and referrals. And on addressing violence against children, as the directorate, we come in both on preventive and response. On preventive is just what I've talked about there on family strengthening. And on responsive, first and foremost, if there's a child who is a survivor or a victim of abuse, the first thing to do would be to rescue and ensure that the child is safe, free from harm. If there's a perpetrator, we ensure that all the due processes are followed. If it's, say for example, it's a parent who has neglected the child, if there's a parent who has neglected the child, we look at the underlying condition, the circumstances, come up with a case plan, address the needs. And if it's something that was done knowingly, we'll check the legal way. Thank you.
All right. Any last comments from anybody? All right.
Thank you very much. I didn't exactly get the questions, how they were framed, but I'll generally answer on violence, ending violence against children, what the Directorate of Children's Services is doing. She has given a snapshot of what we do. Kisumu is part of Kenya where we work, and she's a children officer. So ending violence against children, there is a lot we have done. We first of all started with in 2019, and it has been presented here about the survey that we carried out and the statistics were given. We developed the National Prevention and Response Plan, and we are doing what we call the Spot It, Stop It campaign right now. And actually our CS talked about what we are doing when we started on Tuesday, when she was opening this conference. So all that we do has been said in this conference. And another thing that is very, very important is that DCS cannot be able to end violence against children. It is a multi-sectoral approach. It is all of us. When we all work together, we can be able to end violence against children. Thank you very much.
Thank you, Eunice. And with that, I think we come to a close of our session today. Thank you very much to Mr. Paul Mugambi Mizasesha, Fidelis Mboni, Teresia Nyaoro, and Julia Enoi for giving us and elaborating to us some evidence and programs and services. Please let's clap for them once again. And I think that, ladies and gentlemen, marks the end of this day and this wonderful session. I do wish you a wonderful evening. Rest up. Come tomorrow early in the morning at 8. We begin. Asanteni sana. Good evening.